Welcome, Terry Taylor here with the Tailored Realty team, just bringing you a special segment on today. This month is Mental Health Awareness Month, and we have Dr. Alexandria Smith with us on today, our very special guest. So just sit back, relax, take in this information. We're going to have a lot of good information for you. At the end, if you have any kind of questions or comments, you can add them to the comment section. You can write them down, send them to us at the very end, but we'll be happy to answer any questions at the very end of this. But just sit back, relax, and enjoy this particular segment. So we're going to go ahead and get started. First, and we'll be calling Dr. Smith Zan during this particular interview. She told me that was okay. So Zan, if you could introduce yourself and let us know what inspired you to become a licensed professional counselor.
So I am Alexandria Smith again, Zan, and I would love to say that my journey to counseling was inspired by some event, but it was more like planned happenstance, perhaps. In undergrad, I majored in psychology and criminal justice, only to discover there's not a whole lot you can do with those at the undergraduate level, which would require a master's degree. The University of Georgia happened to have a practicum and internship program that would allow me to wed my two majors, so I wouldn't have to leave either behind. It afforded me the opportunity to provide counseling to adjudicated juveniles. And so that's how I became a counselor, as opposed to being a part of one of the other helping professions.
Awesome. Well, thank you so much for that background. Now, just tell us a little bit. First of all, how long have you been doing it, and what kind of what's your clientele like? What kind of clients do you have?
Right now, I am not currently practicing. However, when I got my master's degree, the first population with whom I worked were adolescents with substance abuse issues. And so I worked at an outpatient treatment facility. And during that time, I was able to get licensed as a professional counselor and get my certification as an addictions counselor as well. And then I went back to school and got my PhD after that because I knew I ultimately wanted to teach. And then once I got my PhD, I worked with survivors of sexual trauma. And at that time, it was Sexual Trauma Services of the Midlands, and it's since become like Pathways to Healing, I think is what they changed the name to. And so primarily, I've worked in addiction settings and trauma settings.
Now, what's the major differences, I guess, between addictions versus trauma? I guess one would be more external and brought on by other forces, maybe. But what would be the difference between addictions and traumas? Maybe?
Yeah. So I definitely get what you're asking, right? Because it would seem virtually impossible to tease those two apart, because then the question becomes which came first, the chicken or the egg? And I'm not trying to invalidate the addictions nor the trauma experience. But some would argue that in some ways you may not be able to experience or have one without the other. Perhaps the trauma was the precursor, and perhaps the addiction became the way of coping. And some people, I want to also be clear because I don't want to be offensive. Some people would even say, well, addictions is more than just coping. Absolutely it is, right? Because then what happens is what started out as one thing becomes, I can't even function without it. And that's then when you get into the disease model of what addictions is and how it starts to impact the way your brain even functions, and chemically you become dependent on it.
What are some of the misconceptions that you come across when it comes to having to deal with counseling? What do you think are some of the misconceptions or misdealings that people have about counseling?
So I think counseling is one of those things that I guess that's why these conversations are so important, because they can help to demystify the counseling process. I think people believe that when you go to a counselor, that person is going to look right through you and see all of your darkest and deepest secrets. Right. That's not what the process is at all. One of the classes that I teach is a Foundations in Counseling course. And one of the textbooks that we use is by Granello and Young. And one of the things they point out is that counseling, literally translated, means to come alongside.
Okay.
And so the authors go on to say that one of their students, when they were teaching that particular lecture, said, yeah, to come alongside with a lantern. So when you think about counseling, I don't want you to think about it being this like mysterious process where someone is going to pick you apart, be critical. That's not what it is. One of the things that makes me so proud of being a counselor is, believe it or not, we come from a wellness focus. While we're considered the baby of the helping profession, our primary lens through which we see the client is one of wellness. And so we believe you are the expert in your own life. We're simply there to create a safe space to help you identify some of the incongruent patterns that maybe have led to some of the maladaptive behaviors that you want to address.
Wow. Wow. Okay. So that's why I think mental health awareness is so important. And I think it's a good thing that we're bringing this particular topic to light. Now, so we've brought it, we've kind of defined things. Let's talk a little bit about, some wellness and coping tools, right? So are there some coping tools that can be utilized whenever we're dealing with these kind of mental health issues or trauma or addictions, whatever the issue is that we're dealing with? What's some simple daily practices that we can use for coping?
So one of the things that I think when we think about coping, we do, in fact, I think, feel like it has to be something extravagant, and it doesn't. But I think the first part of coping is having an awareness of yourself. Whether or not we want to admit it, we all have an awareness of ourselves. And if we don't, I would argue it's because we have not paused long enough.
Okay.
But that would be the step, having awareness of what it is that I'm thinking. Why did this just have that impact on me? And I think another thing is also then being aware of the messages that you send yourself, just even on a daily basis. And if you start listening to some of the messages that you say and consider, how judgmental perhaps you are of even yourself, that then manifests itself in then what you do. It becomes hard to then outlive and outrun those messages that you're telling yourself each and every day. So a part of coping for me is reframing and rewriting the messages that I tell myself and allow myself to receive each and every day. Also, I will say, I think we minimize the impact of simple breath work. I know if, again, a part of attending to yourself, sometimes when we're walking around, I don't even think we realize how tense we are. Like sometimes when I'm sitting at my desk, my shoulders are up here, and I don't realize it until I finally just allow myself to take that deep exhale out.
Wow.
Simple things like that can make a difference. Also, just sitting and pausing in the moment and being mindful. So maybe not assigning judgment to the moment, just existing within it, not worrying about what you're about to do, not worrying about what you just did, just being present in the moment.
And so are there times during the day that a person can just stop and do that? Is that what you're recommending or something we should do?
I would recommend if you can carve out time in the mornings. If not, if your morning is hectic, you're trying to get little people out of the door, at some point, even if like maybe in the drive, in your car, on the drive into work, sometimes I will drive and not even turn the radio on.
Yeah.
Just the silence. But being able to be intentional about creating that space. And I'm actually glad that you asked that question, because that's the problem. So often people say, well, I don't have time. And therein lies the problem, because you have to be aggressive about taking that time. Unfortunately, it's not going to be given to you. And that is why another thing that I do is I set pretty firm boundaries. And people don't always understand why it is that, in the evenings I may unplug completely from my cell phone.
Yeah, I think if you don't set boundaries, then people step all over everything, and they don't respect your time, your space, which I think is good. And that we do set boundaries, just like you said. Another thing you talked about, oddly enough, one of the things I did try to do was pick up more reading. And one of the books I read a few years back, I think the name of it was Breathe. You can find it on Audible. And it talks about how breathing can control a whole lot of things. You can control temperature, mindset, a whole lot of things with your breathing. So I'm glad you brought that point up. I do believe we are walking around stressed a lot of times because we're not breathing or just taking a deep breath. Another thing you mentioned that I think is also prevalent in young people as well as adults and in their professions is the self-talk, something that you talked about a little bit earlier. If you're talking about having a bad day or having a rough day, then I think, I'm not ashamed to say we have a spiritual component. We believe in God, and we do have a spiritual component, and I believe that our words are powerful. And so if we set ourselves up to have a bad day, then our bodies, our minds are trying to figure out how to make it happen, because that's what we said is going to happen.
Absolutely.
So I do believe part of coping is saying the right things, not only to others, but to ourselves. And I really believe even before you get your day started, I think if we can start doing those types of things, it'll be much more helpful for us in everyday life, in every aspect of life. That's very good. Thank you for bringing that up. What's your advice for someone that might be considering, therapy or counseling sessions and may be unsure about it? What's the difference between maybe just normal everyday stressors and then saying, you know what, I think I might need some professional help? Is there a break point, or are there some things that you should look at or consider when you're determining whether or not it's just everyday stressors, or should I seek counseling?
That's a really good question. I think, so if I had the DSM in front of me, which is sort of the Bible for counseling, not to be sacrilegious, but it would say, when it starts interfering with your daily life functioning, right? And I'll give just a brief example. Let's say, for instance, you have someone with obsessive compulsive disorder, right? And let's say that...
Which is kind of like what? What's sort of?
I'm sorry. So like with obsessive compulsive disorder, many times, maybe not always, but many times anxiety is the source of that. Like when we're anxious and you feel like you're like spiraling and things are unraveling, just in human nature, you kind of control what you can.
Okay.
And that may mean like positioning things perfectly, making sure your environment is clean, double checking to be sure you turn things off. And again, it's about controlling what I can, because my life is spiraling, but I can control making sure I don't come home and my house is burned down if I keep double checking that the stove is off. But the problem becomes if, like, let's say you have an event to go to or you have work to go to and you can't get out of the house because you keep checking the stove. Yeah. By the time you're actually able to get out of the house, the event is over. Now, I'm not saying that is when someone should seek mental health help, because we want you to seek help long before it gets to that point. I'm simply making a distinction between a diagnosis versus an everyday stressor. Now, an everyday stressor, in my opinion, becomes a mental health concern, yes, when it interferes with your daily life functioning, but when you cannot rebound from it. So like, for instance, if it's the type of situation where you're driving home and someone pulls out in front of you and it just sends you over the roof, right? But then by the time you get home, you're still taking it out on your family, your children, things that wouldn't normally annoy you because there was this one triggering event. While that may not necessarily be a full-blown diagnosis, there's some emotional control issues because it stopped being about that person that pulled out in traffic in front of you a long time ago.
Very good. Very good. And I think we're dealing with more of that. I think we can see in news, even in our daily lives, people, these stressors and these things that are sending people over the top, we're seeing more and more of that. I think it's getting to a fever pitch where something's going to have to be done in order for safety, people's safety to take place. And I'm glad you bring that up. So maybe that is something we all need to do, is kind of step back, evaluate where we are. I like to tell, and when I was raising my kids, one of the things that I would always tell them is to figure out a response before the event even happens. A lot of times you can cope with things, I think, if you have a response ready-made. If you determine that, this isn't worth me risking my freedom, risking my safety to address this issue. And I think a lot of times the stressors of life, the things that we're introducing in our lives is putting us in these situations. What would you say about like social media and some of the things that the young people are kind of tied into? What kind of effects do you think that's having on mental health?
So my only concern about social media is the fact that it just feels like there's never an opportunity to unplug from it. Um, I'm also a little bit worried that it feels like a place where we seek validation. Because I guess in my upbringing, m- my parents very much emphasized like those intrinsic rewards. So that everything that I do because I want to do well, not because of the reward that I'm going to get from it. So just kind of a funny example, I used to like to watch Family Matters, and Laura Winslow, she got like a certain amount of money for every A she got.
Okay.
So I came home with a really good report card, and I said, hey, can I get such amount of money for every A I got? And both of my parents like that, they were looking at each other like, and it was just kind of like, these are your grades. Like, we're not going to pay you to do well. This is an expectation. So when I see that, and I don't think Marcy would mind me sharing this example. One morning, she was getting dressed for school, and she put out a poll on social media, and she said, should I wear this today or should I wear this today? Now, yes, I was concerned that she did that. I was even more concerned that people respond.
Right.
Like in the mornings,
Yeah.
it's all I can do to pull myself together, and you want me to pick out your wardrobe?
Right.
But it was just kind of concerning that just the immediacy of it all. Like, I'm in my home, but I can invite others in to help me pick out what I'm going to wear that day. Like for me, I guess I come from a place where that feels invasive. And so then when we talk about boundaries in mental health, they're non-existent, because if I'm inviting you in to pick out my wardrobe, then I'm giving you say in other aspects of my life. It just kind of feels automatic that you would then feel like you have an opportunity to comment on other aspects of my life.
Wow.
So that is my only concern with social media, is that the boundaries are blurred at best.
Yeah. That's a good point. And those of you that are listening, maybe put some comments out there. Tell us what you think about that. Should there be boundaries? What role is social media playing in mental health, in your opinion? We'd like to see what you think about that as well. Next, we want to kind of talk about community and support. And certainly, I'm sure it happens in other communities. I know in the Black community, churches are huge, and church is a big part of community. What do you think, or how do you think family members and friends and churches can help support someone that's struggling with mental health? Or, is that something we should do as a community, or should it be more relegated to counselors and therapists and those in that type of profession?
Yeah, good question. So I will say that if you know of someone who is struggling in that area, believe it or not, sometimes it's as simple as asking the question, what does support look like for you? Because I think a lot of times we assume or we think that what I would feel like is support, they would too, and that may not necessarily be the case. So I would ask the question, what is it that you would like for me to do or not do to support you in this? I'll also say that when we think about the church and the community and what we can do, give people permission to be human. Just give people permission to be human. I remember when my mom passed away, I was literally sitting in the funeral car, like after the service in front of the church, and someone reached into the window of the car and grabbed my hand and said, "Be strong." Like, that's not helpful right now. I'm sorry.
Yeah.
Like, I haven't even buried my mom yet, but the expectation is that I be strong. So I would say we need to also perhaps redefine our expectations of what mental health looks like and give people permission to experience a full range of emotions for as long as they need to.
Wow.
I will also say that at St. John and Hopkins, they are having a Lunch and Learn series on mental health issues. And I think it's valuable because it is in the Hopkins area, so it's in a rural area where people may not ordinarily be having these conversations. I think the next one is on post-traumatic stress disorder at the end of June.
Okay.
And you can certainly visit their Facebook page to register. It's free.
Okay.
But I think resources like that are also very important for people, because then you become a part of something larger than yourself. You know, you're not the only one experiencing it. And again, it sort of starts to normalize the conversation. So it's not something that has to be hidden.
Absolutely. That's a good point. I think churches and communities can do those kinds of things. We actually attended one that you were presenting at, and it was an awesome event. So yeah, churches, community leaders, parks, start putting on some of these type of mental health awareness. I think symposiums or community get-togethers, I think they'll be very beneficial, especially during the summertime. Let's kind of ramp up even during the summer when we can get the kids there as well. I know a lot of adults were at the activity, but I think a group setting for kids and giving them the ability to speak and say what's on their mind and allow them to understand that maybe what they're feeling is normal or what they're feeling, again, like you said a few minutes ago, allow them to be human, allow them to make mistakes. And I do agree, I'm guilty of it sometimes, boxing people into doing what I think they should do. But I think that's some awesome advice to ask people, what the support look like to you. So that's a very good point. We want to go ahead and try to wrap things up just a little bit. Maybe a few parting words from you. What are some other things that we can do to help reduce the stigma around seeking therapy or mental health support, or any other closing comments you might want to make? Just something that you think maybe we didn't hit on, something that you think needs to be said.
I think maybe when we think about stigma, I think about like, okay, so where did it come from? And I think it comes from a place where we believe that you should be able to control your mind. And so if you can't, then that's a sign of weakness. And that's not true. That could not be further from the truth. So the same way, if you were physically experiencing a challenge in your body, you would go to the doctor. If you're mentally experiencing a challenge, you don't want to just dismiss it or say, well, it'll get better, or blame yourself for feeling this way. And I think one of your questions earlier was like, what would you say to someone who's thinking about counseling but is a little bit unsure? This is going to sound ridiculous, but counseling, in my opinion, is not unlike any other service that you would receive. So the same way you would ask questions of someone providing a service, if you already have a particular counselor in mind, your first session with them can be literally you interviewing them, asking them questions, telling them your concerns, and making sure that person is going to be a fit for you.
Right.
So I think that's one thing that sort of I would want to say if someone is thinking about going to counseling is don't be afraid to ask questions and express your concerns to your counselor. Like, be honest, it took me a lot to get here, because this is what I was thinking or feeling, and be able to have a conversation with that person about that.
Awesome. Well, thank you so much, Zan. We appreciate all that you brought to the table. I think we unpacked quite a few things. Hopefully we got people out there thinking, maybe even the community leaders and the support systems that are out there thinking about ways that they can help the community. That's what these segments are designed to do, get us having dialogue, get us actually giving back to our communities, because our communities need us. I think the strength of the community the strength of Columbia, the strength of South Carolina, the strength of, again, the nation and the world is it starts with the smallest segments, which are the family pockets. Those family pockets, those family units. I think if we can get those a little bit tighter, and again, I think it starts with some of these topics we're talking about and tightening up our mental awareness and just having things available. A lot of times we don't know what's out there and we don't know what's available. So I hope these segments will help bring about change. We want to do whatever we can to help. Again, we thank you for being with us on today's end. It was very beneficial. I think we got a lot of nuggets we can use. There's some other things, some other segments coming in the future. I know, and I'll speak on it. I know we were doing the exercise at St. John, and there's some exercises and some things that we can do to just kind of unwind and relax and clear our mind and take ourselves to a place where we can just, again, not think about anything. And I believe that's kind of a mental exercise. I know we all can, pick up a water bottle and go to a gym or, lift weights and do things to our physical bodies. But what are we doing to our mental well-being, and what kind of exercises or things can we do to help that? So maybe that's something we'll talk about in the future. But certainly we want to just thank you for coming out on today.
Absolutely. Thank you all for having me.